a standard for screening veterans for lung cancer who may have had exposures that create a greater opportunity for lung cancer? Is there a
Yeah,
scan that's maybe done for them, or can they request that?
yeah, that's a great question. So the criteria that are used in the VA for lung cancer screening are the same as are the rest of the country. And that's because the risk of developing lung cancer from all the different possible risk factors is really driven by smoking. Smoking and age are the two factors that really drive the risk of lung cancer. There are some other proposals that are out there to use like lung function and maybe some other um, um, characteristics of the patient that we don't really do right now, but there's some studies that are ongoing. In terms of military exposures, we can't really quantify them at this point for lung cancer exposure. So we don't really integrate that into the medical recommendations around lung cancer screening. But lung cancer screening, let me just go to my activation tip is that if you are eligible for lung cancer screening, then that should be available from VA. And if you have smoked ever in your lifetime, please talk to your primary care provider to ask if lung cancer screening is right for you.
Okay, thank you. That's really helpful. Dr. Kelley, there is a stigma around military personnel being at higher risk for lung cancer than civilians. Is there an elevated risk for those in the military? And if so, why is that?
There have been some reports in the medical literature of a higher risk, but those studies were small and initially didn't control for some important risk factors, in particular smoking. So smoking is the greatest risk factor for lung cancer. And if you've ever smoked, then you should be considered for lung cancer screening. But the military personnel have a higher rate of having smoked sometime in their life. Luckily, there have been a lot of people who've quit, and that has resulted in the current smoking rate of being about the same as the general population. But the fact that they have smoked in the past, and military veterans have smoked in the past, does increase the risk. Military exposures, we don't really take into consideration right now in terms of lung cancer screening or treatment. But if you do have a particular exposure that you're concerned about, then please talk to your primary care doctor, and we can discuss with you whether there's a screening test that might be appropriate. But generally, we don't do that.